So just to kind of take the story forward from smallpox, some of you may recall the event of the SARS outbreak in 2002. Now, this really alerted global health officials to the idea that there were these possible emerging pathogens that were untreatable, that were not yet known, and that could be really devastating, not only cause lots of illnesses, but massive economic damage as well. Right around that time, a new strain of avian flu was circulating. And avian flu, the issue with avian flu is that if you get it, you're actually very likely to die from it. It has about a 50 or 60% case fatality rate. The fortunate thing is you're only going to get it if you are very affectionate with a chicken or a fowl that has the disease. Not to say affectionate, but you're in very close proximity. So the real fear that public health experts had in the period around 2004, 2005, and onward was that flu, which mutates quite easily, especially in these reservoirs in which ducks and chickens and humans are living in close proximity, would reassort or transform to become easily transmissible the way that seasonal flu is among humans. And if it maintained anything close to that kind of case fatality rate, remember that the 1918 flu had something like a 2% case fatality rate, and we're talking about 50%. This is going to be a massive catastrophe, probably one of the greatest in human history. So all that is to say, global health officials were on vigilant alert, using these tools of preparedness we've been talking about, scenario-based exercises, stockpiling Tamiflu, developing sentinel devices to track the onset of a possible humanly transmissible flu. Suddenly in early 2008, reports came from Mexico, surprisingly, since they thought it was going to come from Asia, of a new respiratory illness that was killing people in high rates. The existing preparedness measures were very quickly triggered. Countries in Europe and in the United States had developed national mass vaccination campaigns.
And when you say triggered, tell us how that system works.
So all of the wealthy countries had developed pandemic preparedness plans that involved things like mass vaccination programs, and they'd even reserved enough vaccine for their populations, because of course these had to be reproduced rapidly once the strain was known. They produced enough vaccines for their populations so that in the event of the detection of an outbreak, they could rapidly put into motion this vaccination campaign. So that was done by June, within a couple of months that was done. By July or August, it was actually known epidemiologically that the case fatality rate was not so serious. This was swine flu. This was not H5N1. So in other words, they had been preparing for the wrong kind of flu. In Europe, countries had spent billions of euros on these vaccination programs, and only 5 or 10% of the population at best was taking the vaccine. So it all went to waste. And pretty soon, the World Health Organization was accused of conflict of interest. They were accused of being in cahoots with the pharmaceutical industry for having exaggerated the threat, sounded a false alarm. And I think that was a red herring. Really, what happened was that they were kind of trapped by the very system of thinking about the future that they'd put into place in response to a different threat.